All right. Well, thank you all for joining us tonight for our Financial Fireside Chat webinar. I'm Lorna Wounded Head, and I work for SDSU Extension. I'm the Family Resource Management Field Specialist, and I'm happy to have Penny Kelly join us this evening. She works for CHAD, which is the Community Healthcare Association of the Dakotas, and she is the Outreach and Enrollment Services Program Manager. And so she's going to talk with us tonight about Medicaid, what it covers, who qualifies for it, and why the expansion is so important. And so I will let Penny go. Thank you very much.
Thank you, Lorna. Hi, everybody. Like I said, I'm so glad that you're here with us, especially in this beautiful evening. And as Lorna said, my name is Penny Kelly, and Outreach and Enrollment Services Program Manager for Community Healthcare Association of the Dakotas. Now, that's a mouthful whenever I have to say it, but I work for CHAD. So I've been in this position, a little over 4 years. Before that, I spent 4 years at a health center, and that's a certified application counselor, which basically does the same thing that us as navigators do, but they're embedded in a health clinic. And before that, I worked at the Department of Social Services in the Medicaid and SNAP office, and that was when the Affordable Care Act was implemented during that time. So I've kind of been involved in this for a really long time. And as I go through this information, please feel free to ask questions at any time, speak up. I know if I wait till the end, I don't always remember it. So speak up anytime you like. Just to let you know a little bit about CHAD, it's the leading advocate for primary care in North and South Dakota, and I do service both South and North Dakota. And our mission is to improve access to affordable, high-quality healthcare for everyone. We envision a healthcare system that's truly accessible to everyone. We're going to look a little bit at CHAD. CHAD helps educate communities about health insurance options and connects them with some local trusted resources. As I said, Get Covered South Dakota is kind of an arm of CHAD. It's where it started with the grant, a Navigator grant, and it's still being funded through that today. And our goal is to educate individuals on the significance of health insurance, and we provide assistance with the enrollment process. What are some of your first thoughts when you hear about health insurance? Go ahead and if you have any comments, just can unmute and see what your first thought is when you hear health insurance. Okay. Well, I do know that a lot of times people end up saying, when you hear about health insurance, it's confusing, it's costly, it's, I don't know how to get it done. And people say that it's cheaper on the marketplace, but it can be complicated when you're trying to go through everything on your own. And so I'm going to go through how our team can help people with Medicaid and marketplace insurance and let you know what insurance is from start to finish. So the role of navigators, and like I said, I am a navigator, and we do have 17 navigators across the state, and we help people enroll in marketplace and Medicaid plans. Of course, there are DSS offices that help with the Medicaid applications, but even that, with them being kind of overwhelmed with expansion and things, we've been doing a lot of those enrollments to help them along. And the navigators, we are trained, we're certified, and we provide unbiased, confidential help to people. So that's a nice thing. We're not somebody that charges. We do not earn any commissions or anything. We're just here to help because we really want people to be covered under health insurance. As we kind of do a lot more in here, but one big piece of it too is we provide help for people to understand their plan after they get it and what what happens if you do lose coverage from one place and maybe you lost Medicaid coverage and now you need to go to Marketplace or vice versa. The one thing about navigators is that we're different from insurance agents. We don't receive commissions and not affiliated with any insurance company. And this is so that, you know, I ensure that it remains consumer focused and impartial. We really, we can be valuable in the underserved communities or rural communities, which I grew up in Kennebec, South Dakota. So there are people that have some barriers like language, digital access, and that we're able to help people walk through that. One thing to note as well is that with the oh, it just got lost here for a second. We're different from like the insurance agencies, like we said, because they do receive compensation. But the only way to get any tax credits or subsidies to help with insurance is going through the marketplace. And the plans that are offered by any of the insurance agencies are the exact same plans that are offered on the marketplace. And so the same ones, it's just that you have to go through healthcare.gov in order to get those potential tax credits. So, you know, I'm not sure how many of you are involved in your insurance, or you just have your card and you hand it to the doctor or hand it to the receptionist. But just to give you a little bit for someone that maybe isn't quite as savvy, the premiums are the payments generally accepted, or excuse me, made every month for your insurance company to maintain coverage. And of course, you have to pay your premium regardless of whether you use your health insurance or not. But and this will make sure that you, of course, insure your coverage. Now, a deductible is the dollar amount consumers have to pay for healthcare services before their plan will start paying for their care. Now, the deductible may not apply to all healthcare services. You know, for some plans, you don't need to pay the deductible before they'll pay for some of your primary care or your prescription drugs. Deductibles differ by plan, so we need to look through them and make sure we make what you need is what you're getting. For a copayment or copay is the fixed amount you'll pay for a covered service or some service or supply, like at the pharmacy. Copayments usually set a set amount, maybe $15 for a primary visit, maybe $35 for specialty visits. And of course, that amount of the copay will differ based on the type of the care or services. And some won't have a copay, such as preventative services, and that was brought into with the Affordable Care Act, that preventative services are covered at no cost. There's no lifetime maximum on your coverage, and also pre-existing conditions can't be a limit on getting health insurance. So. One last one is the co-insurance. It's the consumer share, what you would pay for a covered service. So if the cost of a visit to a specialist is $100, and so if you have a 20% copay, you're paying $20. Excuse me. So, and I am starting with marketplace coverage, but I will get into Medicaid here in a little bit as well. But for marketplace coverage, who can get marketplace coverage? The marketplace is designed for people who don't have insurance, either because they're not offered coverage or they can't afford what's offered to them. Also, many self-employed people, of course, don't have that option. And it's also available for people that can't afford their employer-sponsored insurance. There is a term for affordable, and sometimes what we think is affordable may not be what they think is affordable, but it's a percentage of your income. If you pay over 8.39% for your employer insurance, that's considered high, and so you can go out and get marketplace coverage. Now, of course, to qualify, you have to live in the US, and you have to be a US citizen or a lawfully present immigrant. You also need to be ineligible for Medicaid or Medicare. So if you do qualify for one of those programs, marketplace coverage isn't for you because you wouldn't be eligible for any of those subsidies or tax credits. And you can't be in jail, except for some people that are pending disposition of charges, then they might be able to enroll. And what this coverage does is it helps fill the gap for people who don't qualify for public programs like Medicaid and CHIP and don't have access to that affordable job-based insurance. So what makes it affordable on the marketplace? The first thing is what's called a premium tax credit, or APTC, which is the advanced payment of a tax credit. And what this does is it helps lower the cost that you pay every month, for your premium, whether you use your plan or not. It's based on income, and if you qualify, it's applied automatically to your monthly bill. So you're not paying full price out of pocket. They actually pay the insurance company for whatever you are eligible for. And then there's also something called cost sharing reductions, or CSRs. And what those do is they help lower what you pay when you actually use your insurance for deductibles, co-pays, co-insurance, that kind of thing. And the good thing about going to the marketplace, when you shop for a plan, you can compare them side by side. They give you the full picture of what each plan is going to cost. You can do your full plan for the year, including your premiums and deductibles and everything. And it's just right there. It can be pretty clear. And what that does is it makes it a lot easier to find a plan that works for your budget and what you need for your health care. If somebody might have a spouse that, oh, I don't need health care because I don't go to the doctor. Well, you can look at a plan then maybe that has a higher out-of-pocket maximum or something, but with a lot lower premium if they don't use it. So in the marketplace, there's key enrollment periods, and that is open enrollment, and that is from November 1st through January 15th. Right now, there is a proposed order to shorten that time period, but we'll just need to wait and see on that. Or you can have a special enrollment period, such as your income changed, you lose health insurance or Medicaid, you get married, have a baby, adopted a child, moving, or gaining membership in a federally recognized Native American tribe. So there are actually other special enrollment periods that you might qualify for, like 150% and under of the federal poverty level is a special enrollment. Now, of course, you guys aren't going to know this, or you shouldn't have to know that. That's where we come in and we can help look and say, okay, yes, you are eligible for special enrollment, or no, you're not. And that's what we can help you through with. Now, I'm not sure how, like I say, how much you use insurance or if you have insurance. So just a quick terms on an insurance card. Of course, on number one, member name. It's a person who's covered by the health insurance plan. It may also show a primary subscriber if it's a family plan. Then, of course, there's the member ID. And what that does, it just is the unique ID assigned to an individual insured under the plan. Of course, providers use it to look up for coverage and claims. If there's a group number, that's usually through an employer or an organization. Plan type, this tells what kind of plan it is, like an HMO or PPO, and it affects which doctors you can see. It'll show your co-payment typically, whether that's for pharmacy, specialist, or primary care. Of course, phone numbers and all of that are on there as well. So now we're going to talk about the marketplace and Medicaid and what the key differences are. So there's two main ways that people can get health coverage through marketplace, private plans, or Medicaid. I guess I should say affordable health coverage. Now, who can enroll? So marketplace coverage is for individuals and families who meet certain income guidelines, and that has to be, it's over 138%. Once again, that's something that we can help people to determine. Where its income is typically a lower income, but one thing to note for low income, if you are self-employed, say you are a farmer or rancher, you get to use the net income of what you expect to make. Whereas if you're have a job, receive a paycheck, then you use gross. So that does help people maybe that aren't eligible for tax credits, but because of their net income, they might be eligible for Medicaid. For the marketplace, usually you can receive tax credits and the cost share reductions anywhere from 100 to 400%. Once again, we have our charts and things that shows you that. So the below 138% is, of course, this is the expansion. So before, if it was 100%, if you were between 100% and 138%, then you wouldn't be eligible as an adult or anybody that didn't meet so very low income, then you wouldn't have been eligible for Medicaid. And so there was this, it's called the coverage gap. So you made too much for Medicaid and then you made too little for Marketplace. But with Medicaid expansion, it really did expand that to single adults, to even married adults with no children. One thing that we found as we started enrolling people in expansion was that the misconception is that many people don't work or they don't have a job. People that we're finding are maybe college students, people that, if you have a family of 4, you have to make a certain amount of money to be eligible for Marketplace. And so maybe Medicaid was the best piece for them. Now, for Medicaid is also CHIP, Children's Health Insurance Plan, just basically funding categories. With that, there is a lot higher income for just the kiddos themselves. So it goes up to like 209% of the federal poverty level. So like we talked about before, Marketplace is open enrollment or a special enrollment period. Now, Medicaid, you can enroll year-round anytime. And actually, if you enroll and you have past doctor visits, they can go back 90 days, or excuse me, 3 months in order to pay any of those bills. So that's always a nice option if, you didn't have the coverage and then you realize that you probably should have, and they can go back on Medicaid. And for the Marketplace, when it depends on who is on an application, it's people that are on a tax return together, like the main person and any of their dependents. Medicaid typically goes by who is living in the home, and whether, if it's unmarried couple and they have a kid, that kind of thing, that would be a household, even though they probably do separate tax returns. So just a little key differences there. One thing with the Marketplace, Native Americans can enroll or change plans every month if they so wanted to do so. It's not just open enrollment. And part of that comes from the treaty rights from many years ago that they have that access to care. There are lower costs if the income is below 300% of the federal poverty level. And there are also no deductibles, copays, or coinsurance if they're within that percentage as well. The good thing is that you can keep any provider that you might have. If you live close to an IHS facility, you can still use your IHS facility. But the good thing is they're getting paid from an insurance company when you do that. And something else that I found is that people use IHS, which is great. But if they need a referral out for a significant injury or a surgery, typically IHS isn't able to fund that. So having that insurance is a good piece to have in your back pocket. So, and you, even if you receive those services from IHS, you still can get Marketplace insurance. So just to give you a little bit, South Dakota by the numbers. So we have found out that children enrolled in Medicaid or CHIP are 4 times more likely to have regular care, make sure they get their well visits and make sure everything is up to date. And adults who enrolled in Medicaid are 5 times more likely to have regular care. Insured workers are less likely to call in sick, reported increased morale and satisfaction when they have access to health care. When you're sick and you still have to go to work, that's a little bit more difficult, as you know. And if you're a farmer rancher, you know you can't. When you call the boss, your cell phone rings because you know you're calling yourself to say you can't be there. Um, but just during open enrollment for 2025, which you said was November 1st through January 15th, 54,721 people in South Dakota enrolled in marketplace coverage. And there's almost 150,000 individuals in South Dakota that have Medicaid or CHIP. And there are still 76,000, over 76,000 people that still need insurance in South Dakota. So that's kind of that's why we're here. And of that amount that enrolled in the marketplace, 93% of them had premium tax credits to lower the cost. For example, my health insurance through my employer, they pay for my coverage only. And for my husband, it's extremely expensive. And so we were able to go to the marketplace, use tax credits for him, and able to get that premium knocked down. Because before with my current health plan, it would have cost, it was about $15,000 a year to my employer just for his coverage it was like a $12,000 deductible and a $25,000 out-of-pocket maximum. Not 100% on those, but it was super expensive. And by going to the marketplace, we were able to get a plan that fit us a lot better. So let's move on to Medicaid. These are the main coverage groups that we have for Medicaid. There are some specialty ones as well, which I can go through too. So it's children under the age of 19, and that's a category that's been there for, well, I think since Medicaid. And with in comparison in the marketplace, you can have your child on your insurance until they're 26 years old. You know, maybe they're in school or haven't got a job with insurance yet. A parent or caretaker relative caring for a child under the age of 19, a pregnant woman, and of course the expansion category, which is adults between the ages of 19 and 64. So they can't be enrolled or entitled to Medicare. So if you hit that Medicare age, you're not able to have marketplace. Of course, blind or disabled individuals that have been determined disabled are also eligible for Medicaid, and the age is 65 and older. And like I said, it might be a little bit confusing here because it says 19 to 64, and then 65 and older are eligible. It's just that they are some different programs. Like I said, this is expansion, and this may be long-term care services. They also help pay for Medicare costs, and that's called the Medicare Savings Program, but it is run through the Department of Social Services, but it is paid for by Medicare. And so that's something we help people fill out applications for all the time as well. Certain incomes, they might pay your entire Medicare premium, your deductibles, or they might pay part of it, you know, depending on the income. Now, if someone does have Medicaid, they must report their changes within 10 days. If that's not done and they get a word that things have changed, then that could avoid, or assume that could cause loss in coverage if they're become no longer eligible. And those changes include income, resources, but the resources like your home, cattle, everything that you have is not counted for Medicaid or marketplace. It does for some of the long-term care, like nursing home facilities and stuff, resources do count for that. For sure, let them know if you change your home address, you're not going to get important stuff. And if you become eligible for private health insurance through yourself or a spouse, that's something you need to let them know as well. Now, when you do an application, DSS has up to 45 days to process all new applications, and they may request verifications of income, monthly income that is earned or unearned, the whole household income. And if you're a citizen, like I said, you have to be a citizen or eligible immigrant. Your tax filing status, that kind of determines how, what you get is um, how that is calculated. And in some instances, child support cooperation, that is some situations that applies where if they're receiving services and there's no child support being paid. However, there is a good faith, good cause clause that does allow to not share that information if needed, like in danger or the father doesn't know or that kind of thing. So how do we learn, or how do we get help? How do we know what we're eligible for? So of course there is the DSS website. But what we suggest people to do is find information on the Get Covered, our website. That's where you can connect with the navigator to help walk you through the process, whether that's Medicaid, whether that is marketplace insurance, or the Medicare savings program. We don't help with the regular Medicare, the Shine program in South Dakota. There's Pierce, Sioux Falls, and Rapid do have offices that help people make their selections on their Medicare. And how to connect with us. You can find our information on a computer. We will do webinars just like this, in person or over the phone. On our website, there is the option to fill out the contact for a navigator. And by doing that, someone will reach out usually within 24 to 48 hours, but honestly, it's more often quicker than that. Now, of course, if something's really busy or things going on, it may take a little bit longer, but typically it's within that same day that someone attempts to contact you if you need questions. This year we put a new tool, and it's to schedule an appointment with one of our navigators. It's online scheduling. That's also available on our website. Just pick a time, a date, and you can, they say that they're for an hour, but if you just have some questions that you want to ask or have them, maybe run a scenario on what you might be eligible for, you can just do that as well. So it's really easy. You get an automatic Zoom link sent to you when you do the when you schedule an appointment, and it also goes through what to bring to an appointment or what you should have available when you are having an appointment. Like I said, we do have 17 navigators across the state. Some of them, although I'm included in this, I don't consistently do enrollments anymore, but I do them. And that's one of my favorite parts actually, is helping people do the actual enrollments. But we have people so Alex and Emily and Charisse are all in Sioux Falls. Kathy and Fran and Sarah are actually all volunteer navigators. So we, help them pay for their training, and they're able to enroll people, or at least provide them with that information that they might need. And that's at Health Connect, South Dakota. Myself and Judy Euchre are in Pierre. She is at South Dakota Urban Indian Health. And I said I mainly do virtual, but I'm willing to help any way I can. And Sarah is at the Flandreau Santee Sioux IHS, and she does a lot of enrollments every year. Our West River navigators, we have Vicki and Joe and Judy and Melissa are all at the Western South Dakota Community Action. And they travel all around the northern and southern hills to help enroll people and talk to them about insurance. Rima, she is a navigator at Complete Health out in Rapid City. And Lynette works with Horizon Healthcare from Isabel. Like I said, even though, they're located in different areas, we can reach every part of the state. So there's always somebody to help. Recently, what we have started doing And as you know, there's a lot of changes that have been proposed to Medicaid, to the marketplace. And so what we started doing is we're trying to highlight the importance of health insurance, whether that's Medicaid or marketplace, it's all insurance. It all helps keep people healthy. And when they're not healthy, it helps them when that happens. So like I said, we started collecting the stories. Those are all available on our website as well. There's a couple more from some navigators and from some individuals that have used um, navigator services before. What we really want to do is we center on each person and how they want to share their story, whether it's through a conversation, video, something written. They do have a video of me out on the website. Not my favorite, but anything for the cause, right? Once again, here are some resources. You can get covered southdakota.org, where you can find a lot of information. And you follow our LinkedIn page or at Community Healthcare. A lot of resources there. I am going to pause for a minute and see if anybody has questions on what we went over already. And then I'll show you some of the things on the marketplace that you can use as an estimator and see what you might be eligible for. And it's, once again, it's not that something you have to do on your own. We're happy to help at any point in the game. But does anybody have any questions or want something deeper? And I know that was a lot of information, but that's the thing. You don't have to be an expert in it because we have been trained. We are certified, and our services are always free. So, but any specific things that you want me to talk about or kind of hone in on?
So I have a question. I was wondering, or just for clarification, it, it doesn't matter what your income level is to get insurance through the marketplace. You can get it because you don't have insurance, right?
No, that is true. Anybody can get insurance through the marketplace, depending on income, and actually goes a little over 400% of the federal poverty level, which for that is 400% of the federal poverty level for one person is 60,000. And so that's the highest it goes. But anybody from 100 to 400% can purchase marketplace insurance. If their income is higher than that, well, higher than that, they can still purchase marketplace insurance, but they're probably not going to get the reduced premiums or the reduced cost shares or out of pocket and deductibles and that kind of thing.
Okay.
Typically, like we showed, 93% of the people that enrolled in marketplace in South Dakota did receive tax credits and the cost share reductions. So yeah, and like I said, I'll run through some of those scenarios with you
Mhm.
and just kind of let you see. And I know I'm not sure what all of your professions are, or spouses or family, but like I said, that there's pieces for everyone, whether there's Medicare, Medicaid, CHIP, and the expansion category, which is for the people that kind of fell in the middle. Uh, and once again, you don't have to make that determination. We can help you. And with, like say, if you're a farmer, rancher, that kind of thing, I actually help quite a few in the Midwest here in rural South Dakota. But the income that is actually net income for anyone that's
Mhm.
self-employed, and it's gross if you get a paycheck, and so that does make it very affordable for farmer, rancher, that type of thing, because you're getting to know what is available after your taxes and after your
Mhm.
your write-offs and stuff. I know
Mhm.
small business, and that can be a huge difference from what it say you make to what you actually make. So that's
Yeah, because I think there's a misconception with farmers that they have to include all of their assets, and like gross income. So it's good to know that it's just net. So I've had people say that they're through the marketplace, their premium is like too expensive for them to be able to afford. So could that possibly be those individuals that are over that $60,000 that or that 400% percent of the poverty level or um
Yes, it could be that.
okay.
Or most often what we find is because the questions and the applications are not easy to go through, that when people go through it on their own, they might make a mistake. And if they make that mistake, then they're not going to show their tax credits. For example, there's one question that says, do you, would you like help paying or something? And sometimes people mark no, because they're thinking, oh, I'm just trying to get insurance, right? And so, but if you mark that, it's going to come up that you are asking for no tax credits. So it's going to give you the price of a full price plan. Um, Sometimes depending on, when you lost your insurance or just different things if you don't, because there's dates for everything. And if you're not within that date, then it'll say, oh, no, you're not within that date to apply. So you purchase, but you don't get tax credits. And I think
Okay.
that's what happens most of the time.
Okay.
Yeah, and then also with I said the net and gross, that's a huge thing.
Mhm.
Not everybody knows. And the who's in your household, uh, what that's yourself and your dependents. Um, Sometimes um with like for Medicaid, it's like who's in a household, maybe unmarried, but you'd still be considered a household if you're eating and living in, not a roommate situation.
Mhm.
There are several different ways to apply. If we go out to the marketplace, healthcare.gov, that actually does kind of the evaluation for what you would be eligible for as far as tax credits and subsidies. And if you're not eligible for those for some reason, maybe you don't make enough money, which is where Medicaid comes in, then your information is electronically sent to DSS, encrypted, nobody else can get it. And so then they run their determination on whether or not you are eligible. And that's where they might ask for some different documentation and that kind of thing. But um, yeah, so there are, and that's why I think our services are so valuable because you want to get it done right. And, even just regular, insurance with nothing else going on is complicated. Um, Not everyone knows that, pre-existing conditions don't matter anymore. And there's um, no lifetime limit. And that even if you so say you purchase insurance, maybe you're paying 0 or maybe you're paying 100. All of your preventative, which would be all your health screenings for adults and then women and men separately as well, are all covered free of charge. So your all of those services are free of charge. You need a colonoscopy or mammogram; those are covered under those preventative services. So that's a good piece of that too. I do find a lot of people that say, "Well, I don't need health insurance. I don't get sick." Well, I say that this is kind of it stops the bleeding. I mean, if yeah, you don't think anything's going to happen to you. I was I would have been 25 or 26 and I was with my first job. And luckily it gave me health insurance. Um, and I ended up having a seizure. Never knew anything. They started doing tests, found out I had a brain tumor at that age. And I can't imagine what my life would have been like if I had to pay for that. And a lot of young college kids are, that they say that one of the most uninsured groups are between like 21 and 29. And you never know what's going to happen. My not really a joke, but joke is you never know. I might get run over by a bus tomorrow. Probably not in Pier, but yeah. And so having that safety net is definitely something that, like I said, if I not had it, um, I don't know, I probably would have ended up going bankrupt, and that wouldn't have been a good situation. So
Do I understand that this is not for senior citizens? This is for younger employed people.
employed or unemployed, or I guess you could say underemployed, where they don't have insurance, sometimes working a couple part-time jobs. But no, if you are eligible for Medicare, then you're not eligible for Marketplace.
Okay.
However, there are the savings programs that Medicaid helps you with, and so we also help with that. And they're called QMB, Slim B, and people do get it confused a little bit because they say it's Medicare, but then it's run through Medicaid, and so it does get a little confusing on that too. But what it does is helps pay your Medicare premiums, maybe a prescription plan, that kind of thing. And that's also what we can certainly help someone through if they need some assistance with that.
Okay, thank you.
Well, I will go out here to this little this estimator on the Marketplace. This is great. You can run it yourself, or run it for a family member. I have a lot of parents call me that say, my just got out of college and they don't have insurance. What am I going to do? And this is something nice that you can go through yourself, or once again, call a navigator, because I can run this for somebody in 5 minutes. So what I'm going to do is I'm going to go out to browse plans and costs. And it does go by the tax credits and everything are determined by your zip code, your number of people in your family, and income. Okay, so I'll just do peer. I am going to say that my household, I don't have Marketplace insurance currently on this. I'm going to say there's other people in my household. And are you married? Yes. And will you claim any dependents? Yes. Okay. We have 2 dependents. And for me, we'll just pretend like I'm 40. I'm not. And so female. So I am eligible for health coverage through my job. Okay, so I'm going to click that for me. I also am a legal parent or guardian, not pregnant, nor a tobacco user. So continue. We'll see my husband at 45, male. He is eligible, of course, but we found out through Navigator Services that he is his insurance is considered unaffordable, which means actually that's another people will really get tripped up. They might have employer insurance, but they think that now they can't even look at Marketplace. But if it's considered unaffordable, and a lot of employer plans are unaffordable, but they can come here and look as well. So we're going to say that he is actually not eligible for health coverage through a job, Medicare, Medicaid, or CHIP. We're just going to go that way. He is a legal parent, not pregnant, or not a tobacco user. Say one daughter is 17, and she's not eligible. Legal parent, pregnant, tobacco user. None of these. Their daughter is 16, and although I'm going to make up these other things, I do have a 17 and a 16-year-old, 2 girls. And so if anybody can give me any tips, I'd really appreciate that. But okay, so they're not eligible for a job, Medicare, Medicaid, or CHIP that I know of. So that's why I'm going to go in here and I'm not going to mark that, because we don't know if they would be eligible. Not a parent, not pregnant, not a tobacco user. So here we go. Just confirm your details. I am going to say, I'm going to set this up so it's parents are eligible for Marketplace, and the kiddos are eligible for CHIP and Medicaid. Just going to try to get this. Let's see. Let me say family 4. Probably should have this written out. I wasn't sure how long or how fast I was going to talk, so that was kind of the here one. And this can be a hard part as well, estimating income, because income from okay, so for Medicaid, they kind of go by a month income. So they might use ledgers if you're farmer, rancher, or self-employed, or your last paychecks. For Marketplace, you have to use future income. And if you're self-employed, you know how difficult that might be. And so once again, we help go through that process. You know, if you're just looking at it yourself and you say, I have no idea, you know, that's a process we help you with as well. So I'm going to say, as a family of 4, we're making about, just going to put in 60,000 and see what we come up with. So this is what I had thought. So it looks like my kiddos might be eligible for CHIP with that income, you know, and I mean, this is both of the parents working, we figure out that's what we make. And so what it's going to do is it's going to send their information electronically over to the Marketplace and, excuse me, over to Medicaid, and then Medicaid will be in contact if they need anything else to make that determination. And once again, CHIP goes a lot higher for the kiddos to be eligible. So it's going to say my spouse is eligible for insurance because he's not offered any insurance anywhere except through mine, and we've considered it unaffordable. Okay. So that means what he might be, get some help paying for his insurance. And because I am already covered by my health insurance plan that is considered affordable because I don't pay anything for my premiums, I'm not eligible for Marketplace. Okay. So what we're going to do here. So we're reviewing the plans. And I will tell you, from if you go out here and you do this estimator, and then you go and you do an application, typically the premiums are within pennies. So this is actually what it would be. And like I said, it's I think what we do, 65,000. So we can look at a Sanford plan for my husband. And because that plan only costs $602 for one person, and the tax credit is $638, his premium would be 0. And it is true that 4 out of 10 people in South Dakota who have gotten insurance through the Marketplace pay less than $10. And then his deductible is $6,000 out of pocket maximum, $9,200. Is that a little high? Yeah. But here's your premium, all your preventative cares cost. And like I said, this might, like I said, it'll stop the bleeding. You know, you end up in the hospital, which my husband was for a week in an ICU. They never determined what was wrong with him. They checked him for everything, but you know, so had we had to pay that bill, that would have been really rough. And then it talks about your primary care. They $50, once again, if you're doing your preventative, that wouldn't be a cost. We'll go down another Avera plan. It was $584, so a tax credit of $638, and so 0 premium with that one. And going down once again, another 0 plan, another 0 plan, 0. I'm trying to get to one that was maybe had a higher. There we go. Okay, so this one. So I decided that we go to the doctor too often. And so having a high deductible or a high out-of-pocket maximum is going to be kind of tough for us. So I'm going to choose to pay $80 a month in the health plan because my deductible is only $500. Now my out-of-pocket maximum for one person is still $3,000. You know, you can go into the ER one time and you take care of that. And then everything after $3,000 is 0 because that's your out-of-pocket maximum. So there are choices, to make as well. So you can, I bet you I can get one that probably goes down even lower. Oh, no, maybe not. Sanford. And the three companies that are on the marketplace are in South Dakota are Wellmark, Avera, and Sanford. And if you went to a broker or an agent, they have the exact same plans that are on here because that's what's deemed meeting all of the Affordable Care Act requirements. And they can, if I went to them right now with this information, you wouldn't get a tax credit because you have to go through here, but they're going to say your plan costs $741 because that's what it would if you went to an insurance agent because they don't do this part. Now, I take it back. There are some insurance agents that do have access to the marketplace and can do that, but I have insurance agents in town a lot call me because they said, well, I think this person's going to be eligible for tax credits, but can you work with them? I mean, and those are the ones that are really looking out for their customers because they know they could sell them a plan, but they say, can you help me with this? And so then they refer them. And, sometimes for eligibility reasons, they can't get into a marketplace through Medicaid. We, say, here's a list of insurance agents, but they're going to pay full price. I'm going to go back now and just change up the scenario a little bit. Like I said, I can do this on the phone, like I said, 5 minutes, with someone. I'm going to edit this information. So I'm going to say that I am not eligible for health insurance. Okay? I work 2 part-time jobs and there you go. And confirm your household members, still there, female, yep. I'm going to confirm. I'm going to move that income up to like, let's say $75,000 a year. Okay. Once again, if you have a job, it's gross, and if you're self-employed, 75,000. Okay, so now it's saying that everybody in my family, due to our income, is eligible for tax credits and to purchase stuff on the purchase plan on the marketplace. Now we're going to look at these plans. And look at that. So we still have 0 premium for a family of 4. Now, the family total deductible is $15,000. And so that would be per individual divided by 15. Out-of-pocket maximum is $15,000. See here, Sanford, another plan. Like I said, the deductibles are a little high, but once again, that's a family total for a deductible. And I think my deductible through my job right now is it's around 12,500. So it's not, but my company pays my premium for me as well. So different pieces. And now something that also is really neat. Here's what we're going to do. We're going to compare this Avera plan. We're going to do a Sanford. And let's see. In the Wellmark are mainly plans are mainly out in the western side of the state, just because they don't have a lot of Avera or Sanford, out west. So they have the Monument plan. So we're going to see if we can find one that has, there we go. We're going to say this one. You see the deductible goes down a lot because it's a $6,000 family deductible. Then we're paying $215 a month. For a family of 4, that's still not too bad. Okay, so what I'm going to do is I'm going to compare these plans. And so it looks here, it shows everything 0, 0, 215. Now, I want to say, well, what is it going to cost me for a year? Because this one has co-pays and this one doesn't. And yeah, once again, way too confusing. We're going to add this yearly cost. So I'm going to say for me, medium use. I go to the doctor regularly. I have some prescription meds. Then we're going to go to my husband, kind of the same thing. If you have a high level of need, actually we'll make him high. How about that? Expecting high use. And then for the kiddos, they just pretty much go for their, preventative stuff that when they have their well child visits. So I'm just going to put low use for them. Now, here's kind of the cool thing. So for someone that needs a lot of, I said a lot of care for my husband, which included a doctor, or a hospital stay, ER visit, the yearly cost when they take the premium, plus, the deductible total out-of-pocket maximum, that you would pay $9,000 out of pocket. If all of those things happen, my husband had a ER visit and he had to stay in the hospital and that kind of thing. So, for your total costs, once again, I think when he was in the ICU for a week, the bill was 150, 180,000, I think. But because we had the out-of-pocket maximum, we didn't have to pay that. And so that's what this cost is. Okay, yep, I can do this. So maybe I'll say, well, I want a zero premium because, I don't think we're going to go to the doctor very much. Okay, well, then maybe do the zero premium. Or if you say, yeah, I'm probably going to go fairly often. I mean, and these are all things that we can help you with. And because I said that can be confusing, we could change the yearly costs so that everybody has high use. And so this would be the absolute maximum you would pay for any plan. Okay, we still have zero premium, but it is going to up this estimated yearly cost because it's saying that the whole family is going to like max out their out-of-pocket maximum. That's why it's 15,000. But just think if your family was in a car accident and you were all in the hospital for a month, you wouldn't pay more than $15,000. That's where I say stop the bleeding kind of thing. But if you're not, you pay nothing and you still get your preventative care for free. And then this is here, zero, just one Severa, one Sanford. They might have copays or not, and that's something that we can look at. And then we also help you determine too, based on your use, which one is better. Because, okay, so this one, you'll notice that's the one with the premium, but this one is zero, and per year, this one would cost more. If you had, that would be because the way things are, the family deductible is, or excuse me, out-of-pocket maximum is 18,000. So that's why that one's higher. But so it kind of depends. Do you want to pay zero? Do you want to pay not? And like I said, Medicaid is for adults under 138% of the federal poverty line. And for, let's see here. So for one person, $20,783. If that's your income for one person, you could be eligible for Medicaid. Which, and the good thing about Medicaid is it also covers all dental and all eye for adults. And it covers for everyone. Marketplace doesn't automatically cover vision and dental for an adult in that expansion category. But you have a family of four and you make $43,000 or less, and everybody in your family would be eligible for Medicaid. So can be very complicated, and I probably went too deep into things, but just kind of trying to make the point that it is complicated, and we know that, and we have the tools, and we have everything that we need to help everyone with that, whether it's yourself, whether it's your kiddo, brother or sister. So my brother had gotten a divorce, and previously she had carried all the insurance. And so he was working, but he didn't get coverage to his job, even though it was a full-time one. I helped him get on his marketplace And that's what he used until he got a job at his school. He's a actually going to get his master's degree now at, what is he? 59 years old. But, and so I was able to get him affordable coverage. My oldest brother recently turned 65 and he retired early. He took a little early retirement. And so until he was eligible for Medicare for those 2 years in there, I helped him get marketplace insurance. And then when he was eligible for Medicare, I, helped him cancel and, there you go. So, I mean, it fits so many different circumstances. Somebody maybe that applied for disability and was awarded disability, which actually can take quite a long time. I don't know if anybody's ever had to do it. Usually one time isn't enough, 2 or 3 times in order to get that determination. And there's a waiting period after you get it for Medicare. Once again, we get people that come here and we help them out to get marketplace for a little while. So, but many ways it fits, just know that call us, and that's what we do. That's what we help people with. So I talked for 1 hour and 2 minutes.